Hi, I'm Dr. Janae Brown, and this is Dr. Nicole Palermo.
Hello.
And we are two physical therapists at Physical Therapy San Pedro.
Mhm.
Today, we wanted to come and talk to you about 2020. We wanted to wrap it up.
Yeah,
we wanted
to stick a knife in it. We're done.
So we wrote a blog called 2020, It's a Wrap. That's it.
Yeah.
We're done.
Yeah.
We wanted to take some time and sort of reflect and thank all of our amazing patients and staff and you all who are our followers for just your support and your trust in us. And we wanted to just thank you guys for sticking here with us, following our blogs and our discussions and tuning in to what we're doing.
Yeah. We know it's been a crazy rough year, but we especially want to say thank you to all of our patients who stuck with us and even joined us through telehealth.
Yeah, right.
So telehealth was a huge learning curve for us.
Yep.
But we, executed it flawlessly, I think.
I think so
we
too.
had a lot of good success, and I know our patients enjoyed it, and we still helped a lot of people even through these changes in this year. So we just wanted to thank you guys for sticking with us.
Amen to that. And we're just very grateful to, some of our patients and our coaches, our community, who really believe in what we do and support us and trust us.
Yeah.
So,
and if 2020 has taught us anything, it's to be grateful for what we have.
Yeah, absolutely.
Yep.
So we want to walk you guys through some of the great things that happened in 2020, and we want to talk about what's to come, right?
Yeah.
All right. So
there's a lot of memorable moments, and we don't choose favorite patients by any means, but there was some fun times that we just wanted to reflect on. So
you want to start us?
Yeah.
So Dr. P is going to start us off with some of her favorite memorable patient moments of the year. So share.
So
share away.
I'll start with one of my top is helping a couple of really special patients that had really bad disc bulges.
Yeah.
And I got them back to working, to powerlifting, to strength training. Yeah. It's always scary for those patients because they think that they'll never get back to doing what they're doing. But we got them back, and some even through telehealth. Yeah. Telehealth and in person. So that was one of my top.
Yeah.
So and shout out to those patients.
Yeah, you know who you are. And I think for those patients, for our athletes are a huge part of our clientele here, who have not been able to participate in sports or have had the gyms closed and stuff. Oh, we've been able to see some of these like barbell athletes that are power lifters, Olympic lifters, set up, have home. We've been able to get to their home gyms and being able to continue to let them, do what they love.
Or they borrowed kettlebells from their home gym and just worked with what they had. So it was good getting creative and giving them the option to work out at home and not just like being closed in a gym too.
Yeah, absolutely.
So that was good.
What about anybody else you can think off the top of your head? Want to share?
Dr. Brown and I always share our ACL patients, but we had the most fun time. They have had the best recovery this year.
Yes.
We've seen ACLs return to martial arts, to football. Back to all kinds of sports, softball. So it's been really fun seeing their progress, and they're always like the funnest to work.
It's true. And you know what? Unfortunately, I mean, a PT, any physio watching right now, any person who works with athletes right now, you always want more time with your ACL patients. I feel like that's the one patient you're a little bit under pressure with to get them back to sport. The timelines have changed, so the information has changed, so they think that they're going to get back to sport a little sooner. Mm-hmm. So we almost like got more time through this year, which has been
ACLs
great
for a year plus.
Yeah.
So and it gets really fun at that late stage.
For sure.
Where you're really returning to sports. So it was really fun.
I really enjoyed seeing my concussion patients get back to sport, back to gymnastics. I had one high school basketball player who got back to basketball and got a scholarship, college scholarship, full ride, which was really cool. So, I mean, concussions are really hard to rehab depending on how long ago your concussion was. So seeing someone who has a brain injury essentially kind of return back is just a really cool thing.
That's
so
priceless.
Those are fun for me to do to help them. Anything else you want to chat on that we remember patient-wise?
I think with telehealth just surprised me that I could help so many people without physically touching them. Like I helped a chronic shoulder dislocator, get strong just from home, just using some bands and everything from home and body weight movements. And she went on and to do ballet again. And it was so cool to watch her consistency. She tuned in. It was kind of like her PE class, and we just strength trained from home. So that was really cool for me to see that telehealth is doable and it's successful.
For sure. When you were saying that, it made me think about, a gymnast that I had at home who we were at the higher level of getting, him back to sport. And some of our experience and being PTs for a while and our confidence in what we do and our knowledge of sort of exercise and strength training and our, being strength coaches helps us feel safe and confident in doing some of the things that we do with patients at home. But I remember having him bring out his mat. We're doing flips and twists and tumbling and working on his mushroom and doing things that are a little scary for you to ask someone to do, at home in front of your computer, right, watching him. But he's so successful. I mean, it just gave him the confidence to go return back to gymnastics, knowing that he had done those things with, me. That was fun.
Cool. That was really cool to watch.
Yeah, that was fun.
That's why you guys should tune into our stories on Instagram. And you'll get to see a lot of those in action sessions.
For sure. And okay, so let's talk about some of the Con Ed courses that we, before we do that, let's talk about some of our partnerships that we have. We have some great partnerships with local community organizations. And so let's talk about some of the things we did with them. We're doing stuff over the summer with,
even though this year seems like a blur, we were still busy and doing stuff. So Dr. Brown was leading, all of us were, but Dr. Brown's like the puppeteer. She organizes us all. We were doing Instagram IGTV live strength and conditioning with our basketball program, so HCE.
Shout out
to HCE, Home Court Edge. If anyone looking for a great program for their basketballers.
Yep, youth basketball, high school basketball, some one-on-one training and stuff.
And we were doing strength and conditioning with San Pedro City Ballet, which ballerinas need to be strong too. So they actually really enjoyed it and tuned in for many weeks.
Yes.
So that was really cool that we were able to facilitate some of ourselves for them.
Absolutely. We got back on the field with Invictus Femine, who is our semi-professional soccer team, women's soccer team that we support, and we do their injury prevention stuff and their game day stuff. So we got back on the field later in the year to do some drills and stuff with them on the field during practice, which was fun, movement drills and strength stuff. So that was really fun that we've been able to do.
And then we just touched on Pick Six youth football. We were just starting with them, and then everything kind of went haywire, but we look forward to getting back to working with the youth football programs in our area. Shout out to Pick Six.
So those are some of the fun programs we support and work with in the community. We really believe in partnering with our community.
We always want to work with more people. So if there's anything that comes up you guys want to bring to our attention, please do. Favorite Con Ed courses. We both took a good amount of Con Ed. All of it was virtual. Well, no, because in the beginning of the year before COVID, she got to travel.
I traveled to Denver, and so shout out to APTA, American Physical Therapy Association. We had our annual conference in Denver this year. I took a ton of great Con Ed courses there. I'm looking forward to returning to an APTA and taking Dr. P with me. I was hoping to have her go with me in 2021, but I think it's going to be virtual probably next year too. So, but shout out to APTA. What else did I do? I did Train Smarter and Harder with Tim Gabbett. Fantastic load management course. Recommend anybody would take that. And then Dr. P and I did the Cal Youth Summit, which through Clinical Athlete and Level Up. That was really great
with their virtual courses too.
Yeah, I think we're being creative, right? And I feel like it's making us step up. So we just want to thank those. Dr. P took a new
course through ICANN, so Integrated Kinetic Neurology. It was really cool. Just kind of like blends ortho and neuro together. So that was really fun. And I love that course. So shout out to ICANN for that.
Yeah. So we took some fun courses.
Always getting smarter.
Getting educated, being better physios for you guys, for you and for us, but for you too. Okay, so what are some things we missed? Things that we normally do, we missed.
Yeah. Well, first thing, this was from our our staff. They miss seeing everyone's bright, shining faces because it was covered half of the year.
Yeah.
So, you know, we'll see them again. But it was always nice to just get that little glimpse of their face while they were drinking water.
There's something about this, like taking this
read your
away is
faces.
just hard. We've lost, you have to learn how to find new connection with that. So just we miss that. We're excited to see people's faces in 2021. Anybody else? Okay. What else? What else do
we miss being on field. We would go to Invictus games and cover their games. We want to go and be with the people again. We want to do prevention, injury screenings, and just
gym workouts, gym stuff. Fight days. I miss my fight days with our favorite boxer, George Navarro. Shout out to George. I think he'll have a fight here coming soon, so stay tuned.
A good 2020, George.
Yeah, we need him to be boxing and fighting soon. So those are fun things to do. We were doing fight days with him, so we didn't get to do any fight days in 2020, but we're looking forward to 2021 doing that. So, what are some things we had fun doing? So I'll say we did a really fun team outing this year. One of our patients has an awesome villa in Palos Verdes, so we had a team beach day outdoors, played some sports. Did some fun things out there. Dr. P made drinks.
My shoulder.
Dr. P was strained her shoulder playing football. She's trying to
just be the best all the time.
Yeah, be the best, and but she's good. She's good. Don't worry. Good thing we can rehab ourselves.
Have to have fun too.
That's right. We had a lot of media days, which were awesome. We recording and doing photos and stuff like that. We've had some really fun staff meetings and team lunches. We really tried to make our staff meetings a place where we get to know each other better and learn more about each other and just be the best for our patients and communicating about what we want to grow in month to month. So those were fun. What else? Did I miss anything? Lunch workouts. Dr. P led us in some lunch workouts. We tried to partner and do some lunch workouts. Tried to just stay fit.
Trying to stay fit, even though we miss those gyms being closed, but we're trying here.
That's right. And then we had some employees join our team, right? So Dr. Miley Bay is one of our employees that joined our team. She brings her dance specialty to our team, and she just joined late in the year here a couple weeks ago. So she's going to be going into 2021 with us. And then we have
Carissa Chu. She is our physical therapy aide. She's been with us a couple months now. She's an EMT. She's an former gymnast and gymnastic coach. So she brings a nice little edge to our clinic as well. So we're still a girl gang here.
Girl gang.
So we're killing it.
Hashtag girl gang.
Yeah, we're killing it because we have lots of goals for 2021.
Tons. The list is really long. We'll try to give you a few of them. Our list is long. You can read our full blog to get it all. But what are some things we want to do in 2021?
Well, we want to continue to support our local community. We want to continue to do performance enhancement, injury prevention, education. We want to just keep our names out there, even if we have to continue it virtually for a little while. And then we want to continue to build an environment to support our growth because we have been growing.
We're growing.
Yeah, Dr. Brown started just her in this office, and it's just good things are happening.
That's right.
So why don't you
talk about that? So one of the things that we have planned for 2021 is relocating. So we're just outgrowing. We love our space, but we're outgrowing it. Our team is growing.
If you're a patient here,
you'll know, you feel it. Yeah, you'll see that it's getting tight. So we have plans to relocate into a big space, a big open space, have sort of a full gym, partnering with a local gym in the community. And just doing some big things, turf and rubber flooring, dance floor, it's everything you can imagine in terms of a full gym. So hopefully that happens sooner than later, but we are working on it. Working towards it. Yep. We also have new blogs and discussions, and we're going to take new certifications. We all are going to do a certification together, a strength and conditioning certification.
Always growing for you guys.
And we're going to try to build some classes, right?
We hopefully in our new space, we'll be growing some strength and conditioning classes and mobility classes. So can't wait to have you guys all join that.
So we welcome 2021. And once again, we thank you for your support, for your likes, for your comments, for your contributions to our success. But
you know what? We're just done with 2020, right, Dr. Brown?
We're done.
What do we want to do?
We want to wrap it up.
2020. We want
to wrap it up. So we're just gonna wrap 2020 up.
See you later, 2020.
Bye.
Bye.